an overview of peritoneal dialysis, which is a type of dialysis involving the peritoneum, which is the membrane around the abdomen, and the use of dialysis fluid. It doesn't involve the use of blood. And this is usually done by the patient at home. So I included a photo of what a standard dialysis machine would look like, a peritoneal dialysis machine. And this can be different from company to company. So the one I added in the photo is from Baxter, which is a medical company that provides the machine, monthly inventory, and medical supplies that makes the home peritoneal dialysis possible. So the question we're going to be tackling today regarding the dialysis process, the peritoneal dialysis process, is what is the process for peritoneal dialysis? And I'm going to start with the approval. So usually when a patient is diagnosed with kidney failure at the hospital or with a nephrologist, the hemodialysis catheter will be placed for immediate use, and you would be referred to a clinic for hemodialysis. Once you start there, within a month or so, if you are eligible for peritoneal dialysis, then a nurse from the peritoneal dialysis department would visit you and have a talk with you and see how open you are to a different type of therapy, which is a peritoneal dialysis. For you to be eligible for that, one, you have to take ownership of your treatment. You will not be going in center. You have to manage your treatment daily at home, and that includes setting up your machine, breaking it down, connecting yourself, disconnecting, observing the germ-free protocols. Basically, your ownership of your treatment is on you. So you have to be evaluated to um, you have to present as someone that can undertake all of those responsibilities without having to come in center and have treatment in center. Then secondly, your health has to be relatively stable, of course, outside of the kidney failure. So if you were to have other complications that would require closer monitoring, then you may not be an ideal candidate for peritoneal dialysis. But I would advise you to speak with your nephrologist and with your kidney team to see if you are an eligible candidate for peritoneal dialysis. So if you are approved and you accept to do this type of treatment, the next thing that would happen would be a surgery that would be scheduled in order to place the dialysis catheter into your abdomen. It could be on the left side or on the right side. And once that is put in, you can start using the peritoneal dialysis catheter any time between maybe 5 days to 2 weeks. It varies by patient. While that catheter is healing up, you will still continue going to hemodialysis, and then you are going to undertake a training period with the peritoneal dialysis nurse. So you will be assigned a peritoneal dialysis nurse who will be your first point of contact for training and also for your monthly clinic visits. You will also have a team of a dietitian. You will also have a social worker, and then you will also continue seeing your nephrologist. So the training is usually two-pronged at the clinic and then also at your home. So at the clinic, of course, you will come in and they already have the protocol in place, teaching you what machine you are going to be operating, the supplies you will be needing, the company you will be ordering from. For example, Baxter ordering your inventory. Depending on the company's rules, some companies deliver your inventory once in 2 weeks or once a month. So you will have a significant amount of inventory in your home if you are receiving delivery once a month. Delivery inventory will include the dialysis fluid, cassettes, probably patient extensions that would help you move around your home. That would be like maybe 6 feet or more. Gauze, site cleaners, um, Just gauze, tape, just supplies that will help you keep your exit site clean and also maintain a germ-free environment. Masks, um, hand sanitizers, even down to antibacterial hand soap. Yeah, they have like a list of things they will deliver to you. Oh, they will also deliver, you will be given at the clinic a scale, a blood pressure machine, a thermometer, because you will have to keep your vitals daily. That is really important. So the nurse is responsible for the peritoneal dialysis nurse is responsible for teaching you all this during training. And of course, if you have questions, you can let her know. Then she is going to make some home visits too once your supplies arrive to help you set up how to connect your machine, disconnect, break it down, dispose of the fluid when you are done, and all that. So she's just there as your point of contact in order to set you up for success in the initial stages, and also be there for you as you navigate this process. So I would say, if you have any questions, the best bet would be your dialysis nurse. Your peritoneal dialysis nurse would be one of the first points of contact that you would reach out to. So that's basically what the training is about. By the time the training is done, your catheter should be ready for use, and then you would start um, putting in fluid into your abdomen, into the peritoneum, excuse me, and then start to carry out peritoneal dialysis. So once that is settled and the fluid goes in well into your peritoneum, you're handling the fluid well, they will probably make an appointment to take out your tunnel catheter for hemodialysis, because you no longer need that as you are now solidly on peritoneal dialysis. Peritoneal dialysis is gentler on the body, it doesn't involve blood, and you need to do it every day. That is the medical advice. So if you choose not to, that is up to you. But of course, the medical team would never advise you to take a day off. There is also the manual peritoneal dialysis, like for a backup in case you need extra cycles of the treatment during the day, or if you have a power outage or something and you're not able to use the machine, you also have the manual option. So the nurse is also going to teach you how to carry out the manual option if the machine is out of commission or you are unable to do that because there's no power in your area. The next thing we're going to talk about is the cycler prescription. So once your machine is delivered and is ready, it's just like a drug prescription. Your machine has to be set for you. Um, it is not set for like in general for everyone. It's just going to be specific to everyone based on your body weight, your size, your body mass, and what you can tolerate. So some of the prescriptions that will be set is like the therapy, which is usually tidal, which is softer on the body. It's not just like a harsh drain. Um, the feeling of peritoneal dialysis is really something that one can't explain except you go through it. So it's kind of like a suction. So at a point, if that suction is running up on dry fluid or like emptying fluid, it could cross the threshold into a little bit of pain. So you want to make sure that there's that tidal where it doesn't suck you completely dry. Then the total volume would be the volume that you would do throughout the night. It's usually during the night as you sleep. So this could be set in ml. For example, it could be 10,000 for some people, more for some people, or less. It just depends on your prescription that the nephrologist wants to prescribe for you. Therapy time could also vary. They would probably start with a certain time and then they adjust as they go. You could run for 8 hours, 9 hours, 10 hours. Um, so I would suggest planning to go to bed or connecting to your machine early enough that you will be done and allow time for you to wake up the next morning and start your day. For example, if you need to go to work, you need to plan accordingly. So most likely no late nights out, because you need to be back home and on the machine. Even if you're not ready to go to bed, you need to connect and that patient extension will allow you move around your home, maybe to the kitchen, to the living room and stuff like that, and then you can get your prescribed time in. The fill volume is the volume that you would have every cycle. So based on your total volume, that would be divided by the number of cycles you have, and then the volume that would cover each of the cycles, if that makes sense. So you would have a particular amount of ml set for every cycle, and the cycle is drain, fill, and dwell. That is one cycle. The tidal volume is kind of like the therapy, which you don't want it to be 100%, but like a 75, 80, something like that. So it doesn't completely drain, where it's like 100 and then it's drawing on nothing and causing pain. The total filtration, that's total UF, total ultrafiltration, total UF, it's also kind of like what's the filtration level. Then the last fill volume, part of the prescription, is actually the last volume that will be filled on your last fill, and that would be the amount of fluid you will have in you through the day. So usually during the day you would not be completely dry. So you can have, for example, 1,000 ml on your last fill, and then you go through the day with that 1,000 ml, and then it will be performing the diffusion and sucking out the waste through the day. And then when you go back on your machine at night, it would be the initial draining out some of those 1,000 ml. Now, of course, you won't have 1,000 ml on your initial drain, because some of that fluid also will be reabsorbed into your body. So for example, you have 1,000 ml, your initial drain could be like 750 or 700 or something like that. Then the dextrose is the strength of your dialysis. That's the dialysis fluid. So the colors go, at least with Baxter, yellow, green, and red. So the yellow is like the dextrose, so like maybe a 1.5, and then the green may be like a 2.5, and then the red is the highest. So basically, depending on how concentrated the fluid is and how much waste they want to draw out, you will be getting the higher dextroses if you need that, and then the lowest if you need that. Now, the higher you go, of course, the more it draws out and the more dehydrated you would be. So all these things will be taken into consideration, and your team will make adjustments as needed. And then there's also the full drains. It could be every hour and a half, depending on how long your entire therapy time is and how long your cycle is. So the drains will be set to the drain will be set to begin after maybe a dwell time of like an hour and a half, or however it is set for you. The weight unit will be set also pounds, so that would be the patient's weight. That would also be recorded for the machine, and then the number of cycles that you have. It could be 5 cycles, it could be 6 cycles, it could be 4 cycles. That will be tailored to the individual. That will be tailored to the individual patient, of course. Then there are other cycler settings. That's for the machine that you could set, and that would be like date, time. You could also set like the brightness of the display. You could set like the sound level. For example, if you're setting your machine up, like the prompts to do this and that, because usually when you set your machine up, you want to set it up at least 30 minutes to an hour before you get on the machine. Now, some people can do it maybe in the morning when they are done taking it down. That's also fine if that works for you. But it's best to do it at least an hour or so before you start, because that way the fluid up top will have time to warm. At the top of the machine, just like the photo shows, where that bag sits, there is a warmer there that warms the fluid, so it doesn't go into you cold, it goes into you warm. Some machines also have memory cards, and you record some of this, and then you bring the memory card with you to your appointment. Some machines also offer that option. You could also get errors during treatment, and it could be, maybe you turn over and maybe you lie down on the connection, or something is kinked, or there's maybe an error with the machine. Now, sometimes it's as easy as just simply stopping it and then kind of giving it time to reboot a little bit, and you continue where you left off. But sometimes it could be like a continuous beeping that it's just an error that you don't know. Now they do give you a book with errors and some troubleshooting tips, but that may be something that you may need help with. So if you get like errors in the middle of the night and it's beeping, you do have a Baxter number at the top of the machine that you can call, and a specific number for your own machine. So it's 24/7 it's a 24/7 number. Someone will always pick up the phone, but it's just, I think one of the most annoying things is like maybe you're just trying to sleep because you have an LED and then your machine is going off at like 2:30 a.m. and you're trying to like, you know, troubleshoot it. Yeah, that is not a nice feeling. You also have a number for your nurse, or the call line number, a nurse line number, a 24-hour number. So in case you are ill, you have any questions, you can reach out to them and they can determine whether it is something that you need to go to the ER or something of the sort. Whether it's weekends or something, there's always someone on call. So that's always a nice benefit. Now, if your machine is totally faulty and needs to be replaced, they are very good about replacing your machine. So, for example, your machine is, it goes down in the morning or something. You will have like a machine by night time. They have like independent people that will deliver straight to you. You just need to package your old machine and they can pick that up and then drop off a new one, or like FedEx or UPS will pick it up and then someone will drop off a new machine for you. So they are really good at that. So you don't have to miss any treatments. But in the event you're not able to get a machine that night, of course, you can do your manuals. Something is better than nothing. Now, I also wanted to talk a little bit about the checkup. So you will be going in to see your nurse once a month usually. It could be more often if maybe they're trying to watch some of your lab results, but usually it will be once a month. You go in, you have lab draws, and then you will likely go back again to see the doctor when the results are ready. That's a nephrologist, and you can go over all the lab results with him, and at the same time you can see the dietitian for tips about your nutrition, keeping some of your labs in check, like your potassium levels, your phosphorus levels, your calcium levels, some of those things that may be out of normal ranges because you're on dialysis. And then you also have a social worker in case you're struggling with anything and you need to talk to someone, just get things off your chest. You also have that available. And then quarterly, you usually have, you bring in like your 24-hour urine collection and then the dialysis fluid collection from the night before. So that would be tested, and in order to see how well you're dialyzing and if anything needs to be changed regarding your prescription. Something really important that they will teach you about during training is about maintaining a hygienic environment, about germ-free, about washing your hands before connecting and disconnecting your catheter, masking, turning off the fan, closing the windows, not having any pets in the room if you're a pet owner. So just stuff that, they want to make sure no germs get into your catheter because there is a risk of peritonitis. If you have peritonitis, that is really not a good thing because depending on how bad the peritonitis is, you could actually need to have a catheter taken out and you need to go back on hemodialysis. So you really need to watch out for that. Keep your environment as clean as possible and just try to maintain that level of hygiene. And you also need to check your dialysis fluid every morning when you collect during the night. It needs to be clear. You need to be able to see. It's kind of like light, like pee, but really light. You should be able to read through it. So if it's cloudy, pinkish, if it's just looking off, then you need to call your nurse because that could be signs of peritonitis. Of course, when you also take your vitals, if you have a high temperature and all that, that could indicate some sort of infection, peritonitis. That's part of the reason why you take your vitals. Also, like your weight will also determine whether you're retaining too much fluid and it's not coming up during treatment. You wouldn't just gain, for example, 3 pounds or 5 pounds overnight. Then some fluid is has been gained, or you're retaining fluid, and your nurse may ask you to do 1 or 2 extra manuals during the day in order to take off the fluid, like maybe eat less salt or whatever. The reverse could also be the case where you pull too much fluid and then now you need to like get some salt in, get extra fluids in, stuff like that. Now with peritoneal dialysis, the diet is a little bit less strict because you dialyze every night, as opposed to hemodialysis where the fluid intake and the diet is more strict because you just go 3 times a week. Um, so that is it mainly about the cycler, the daily treatment, and the regimen is something that you need to be consistent with. They will be checking up with you. You can also check in with them if you have any questions or concerns. But as I said, you are in charge. You have to take ownership of your treatment. Um, if they see you are not, being a model patient, maybe doing what you're supposed to do. Like, for example, you don't do your treatments. If you miss a treatment, you are supposed to call them and let them know, okay, I wasn't able to do my treatment yesterday, which you would want to tell them anyway because you're charged um, for daily dialysis. So if you don't tell them, they wouldn't know that you didn't do dialysis that day. So you want to make sure you do your dialysis daily. You want to make sure you take your meds. You want to make sure you go to your appointments. You want to make sure you do your 24-hour urine collection when it's time, and the dialysis collection. Did I mention taking your meds? You have to make sure if you have any dietary restrictions, you also adhere to those. So it is really, really heavy. Peritoneal dialysis is really heavy on the patient taking ownership. Now, you may also have maybe a partner, a spouse that is also a support system and does this training with you to help you connect and disconnect and stuff like that. So you have people that do that. Maybe they have caregivers, they have spouses, maybe they are older or something like that. As long as you or someone else that is with you every day is able to take responsibility for that, and health wise you are a good candidate, then yes, peritoneal dialysis may be a good option for you. Of course, most people like it because it gives you some sort of flexibility. It also has its cons because you have to make sure you're home early enough in order to connect and do your full treatment before the next day. So, for example, if you know you have an early day tomorrow, you really wouldn't want to be connecting at 10 p.m. or at midnight, because then you wouldn't get 9 hours in, if that makes sense. So, thank you for listening. And if you have any questions about the peritoneal dialysis process, feel free to leave those questions in the comment section. And don't forget to subscribe to the channel. And I will see you again in my next video. Bye bye.